An ethical dilemma is a complex situation that would involve an apparent conflict between moral imperatives. In the nursing field, nurses frequently encounter situations like this, and each case should be handled uniquely based on the circumstances. In this example, we have Sherry, an RN who works for a rehab center that deals mainly with developmentally delayed children. For several years, Sherry has been following the case of Margie, who is now 8 years old and has Down syndrome and has moderate retardation. Margie has made slow progress in achieving basic motor and cognitive skill, but still requires close supervision of all ADLs. Margie is now advanced enough to participate in group activities at the center's day's clinic. Mrs. Works is a 35-year-old widow who has been providing a high level of care for Margie at home, as well as meeting the child's demand for love and attention. Recently, Mrs. Works has been diagnosed with lupus and has been having difficulty caring for Margie.
Sherry, can I talk to you alone for a minute?
Sure, what's going on?
Well, we've been working together for the past 8 years
Yes,
on with Margie's care, and I really trust your decisions. I don't know if you know or not, but I've been recently diagnosed with lupus. The doctor said that my pain is going to get worse, and I've been having severe joint pain, and it's going to get worse. And I've been having trouble with Margie's care, and I don't know what I'm going to do. What do you think I should do?
This situation, the nurse is put into a dilemma in deciding whether to do what's good for Margie, which could be harmful to Mrs. Works, or to do what's good for Mrs. Works, which can be debilitating to Margie's progress. Sherry has been put into a position where the decision-making regarding Margie's care is left to her.
I understand this is a difficult situation. I know that you want to do the best thing for Margie. I know that we also have to consider your health situation. I know that as lupus progresses, it's going to be a challenge for you to care for her. I know that you want me to help you make this decision. It's out of my scope of practice, so what we're going to do is we're going to have one of the case managers, Mr. Ed Twilley, come in and discuss different options so that you can make an informed decision. Okay? Okay. Let me get him and so that we can get together and discuss this situation. Mrs. Works, this is Mr. Ed Twilley. He's our case manager, and he's going to be discussing the different options that we have available to help you make your decision.
What's your name?
It's Ed.
How do you spell that?
That's E-D. Here, I have a card.
Thank you.
I've been reviewing Margie's chart. I see that she is progressing somewhat. Not quite where we really want to see her to be right now, but she is progressing, and I understand that our challenge now is you've been diagnosed with lupus. Mm-hmm. That's going to be a challenge. I can see the situation for you in that you're taking total care of your daughter, but this disease is going to start taking away some of that power that you have to help with her. So as it progresses, it will obviously get worse. So I'm thinking that in your decision, we don't need to make a decision that is rash and all of a sudden just, right there at the end. We need to progress into this as you progress. So our first option is going to be, of course, family. If you have any family members that can help out and give you a little rest, working with Margie, whether it be take days, swap days out, or if you have somebody. I know some families actually have, say, a grandparent that needs a little assistance, can't live by themselves, but that way you can move them in, and then you're helping everybody out. There's also a group home in the area called the Rainbow of Hope Mental Health Center. They have support groups. They have a group home where if the time comes and you need to actually have her reside somewhere, they have that. And then they have the respite care. It's a service where they will send somebody in to give you a couple hours break certain days of the week to get your stuff done. And then in thinking about the care of Margie, we've got to think about the care of you, because what care we take for you in a way is helping Margie also. So with your lupus, there is a lupus support group in the area. It's nice to be with other people that have the same disease you do. You can find out how it affects them, how they deal with the pain and the different issues there. And then there's also the Parents of Special Needs Children support group, and you can actually bring your child there too. There's other children there and work with each other on that. So I have a list of the places, the phone numbers, the directors. You can let them know that I have referred you to those places, because this decision has got to be yours. We can help you with what options you have available, but the decision ultimately has got to be yours, because you've got something that you've got to live with, and you know your child better than anybody, so you know what her needs are. You have any questions?
No.
The key ethical principles involved in this situation are the principles of justice and beneficence. In the principle of justice, the nurse may feel morally obligated to care for the patient and the patient's mother equally. The principle of beneficence, on the other hand, pressures the nurse into making a decision that is the right thing to do for her patient.
According to the Alabama Nurses Association's Code of Ethics, Provision 2, the nurse's primary commitment is to the patient, whether an individual, family, group, or community. Provision 2.1 and 2.2 states that the nurse's primary commitment is to the recipient of nursing and healthcare services, the patient. Nursing holds a fundamental commitment to the uniqueness of the individual patient. Therefore, any plan of care must reflect that uniqueness. When the patient's interests are in conflict with others, the nurse seeks to help resolve the conflict, but the nurse's commitment remains to that identified patient. The nurse strives to resolve such conflicts in ways that ensure the patient's safety, guard the patient's best interests, and preserve the professional integrity of the nurse. Provision 2.3 also suggests collaboration with other disciplines or healthcare professionals to attain a shared goal, which is to address the healthcare needs of the patient. The nurse should work to assure that relevant parties are involved and have a voice in decision-making about patient care. An open dialogue among all parties who have an interest in the concern for the health outcomes.
The summary, the ethical dilemma in this scenario is that the nurse was put in a situation where the decision-making regarding the health care of the patient was placed on her. Because of the rapport between the patient's mother and the nurse felt obligated to provide advice to her patient. She was left with the choice: 1, leave her at home with the mom, which is going to be detrimental to the mom, but good for the patient. Her other choice is to institutionalize the patient, which is going to be good for the patient's mom, but by lessening the burden on her, and may decrease her stress, but at the same time might cause the patient to regress in her therapy, since the therapy will not be getting the same amount of attention at home as at home, and care like what the mom provided at home.
Our group has chosen not to give any advice to the patient's mom regarding what healthcare decisions should be made for the patient, since this is going to be out of the nurse's scope of practice. We did, however, choose to provide her with all the information needed to make an informed decision about the patient's healthcare. We also made our resources available to the family to help ease the decision making. In the end, Mrs. Wertz decided to go home and have family assist her with Margie's care for now, while she's able to still do so. Mr. Ed also helped Ms. Wertz file for her disability so that she will receive financial assistance. Margie continued her progress at home without additional stress to Mrs. Wertz and with the help of family members. Sherry's decision was not only within her scope of practice, but also, considering the Margie's continued progress, was very personally fulfilling.